Let's break down this AMC style question. We'll give you a moment, pause, and then we'll get to the explanation. We're given a 61-year-old landscaper with a history of actinic keratosis. This immediately tells us that this is an individual that is chronically exposed to the sun, working outdoors. And then so we should be placing squamous cell carcinoma very high up on our differential list. He presents with a non-healing sore on the cheek that starts as a red bump and is now scaling, which again is typical of a squamous pathology rather than carcinoma, which usually presents with a pearl or rolled edges. The most important clue is in the biopsy results. So we've got highly atypical cells invading the epidermis, but it's not crossing the basement membrane. Once the basement membrane is intact, this immediately tells us that the lesion is in situ and non-invasive. So now we put all this information together. We've got this scenario where we've got atypical keratinocytes that are confined to the epidermis and a patient that's had prolonged sun exposure throughout their life. We get the diagnosis of squamous cell carcinoma in situ and oftentimes can show up in exams or in the clinic as Bowen's disease. So the correct option in this scenario would be squamous cell carcinoma in situ, and we'll now select that option and submit, and we've got that question right. So we scroll through, there's an explanation down there. We'll quickly break down the other options in the stem. So basal cell carcinoma, like we said, is incorrect because it typically appears as a pearly lesion and invades through the basement membrane earlier. Seborrheic keratosis, this is a benign lesion. You often see on exams described as a stuck-on lesion. You can also see waxy lesion, and it does not show any cellular atypia or invasion on biopsy results. Verruca vulgaris, this is a wart caused by the human papillomavirus, and this shows papillomatous viral changes rather than atypical keratinocytes. And finally, we've got melanoma. So melanoma arises from melanocytes rather than keratinocytes, and this often shows pigmentary changes, and the biopsy description here does not fit that indicative of a melanoma. I hope you guys got that one correct. Feel free to leave any questions down below. If you guys want more questions such as this to help in your preparation for the AMC, check out the AC exam website. There's a question bank on there with thousands of questions to help you get through the exam. We've got countless students who have gone through this in the past and come out on the other side of their exam successful. So I wish you all the best in your preparation and stay tuned for more future videos.